Lenalidomide is the only approved maintenance therapy in myeloma, and it's been demonstrated to significantly prolong both progression-free and overall survival after autologous stem cell transplant in transplant-eligible patients. And we can see this from multiple studies that have randomized lenalidomide maintenance compared to observation. And one of those studies was the Myeloma XI study, which was a very large study run throughout the UK, comparing lenalidomide maintenance to observation after autologous stem cell transplant. In all of those studies, lenalidomide maintenance was planned to continue until disease progression, but patients often ask and clinicians wonder whether or not that's necessary or whether or not we could stop lenalidomide maintenance earlier. And so we've looked at updated data from the Myeloma XI trial to try and answer this question. And what we did was perform a landmark analysis, so looking at patients still on trial at 2 years, 3 years, 4 years, etc., and look to see whether there was ongoing evidence of benefit from lenalidomide maintenance at each of those time points. And what we could see was that even beyond 4 years after maintenance randomization, there appears to be a benefit associated with lenalidomide maintenance in the overall population. And so we went on to try and see whether we could define a subgroup who could perhaps stop earlier. We looked at both their genetic risk and also MRD status, and what we found was that even in those patients who had sustained MRD negativity for a 6-month period, there was clear evidence of a benefit from lenalidomide maintenance up to 3 years, and it may go beyond this, but we need longer follow-up from the trial to be able to determine that for sure. But what is clear is that if we're thinking about designing studies to determine when we could stop lenalidomide maintenance, data from our study suggests that this should be after 3 years of lenalidomide maintenance have been completed in patients with sustained MRD negativity.